Okay, I want to thank everyone again for joining us this morning as we review our newly revised collection forms. That is the initial form, the IEM-1 form, and the repeat form, the IEM-1A form. As I indicated, we are recording the webinar. That way we can distribute the link as well as the slides to you at a later point, and you may use that in your facility for training of other staff and updating as the years progress. We hope to expand these training offerings down the road, including shipping training, blood spot collection training, and a variety of other program-related matters, and we will be sure to contact you as those come about. After I present the laboratory portion of the webinar covering the newly revised forms, staff from our newborn screening follow-up program will present some slides on a continuous quality improvement project that they undertook, looking at the importance of accurately completing these forms I'll discuss as we proceed. Before I actually get into what is new about the forms, I want to stress that those of you who have existing inventories of our current forms should continue to use these forms until they are exhausted. Please do not discard or waste these forms. They are perfectly viable for use, provided they have not yet expired. A few hospitals have already run out of the initial forms and have been using repeat forms in lieu of initials. I'm pleased to state that our inventory arrived early and were overnighted to all of your institutions yesterday and should be arriving today for use. Therefore, this is very timely information in terms of how to use these new forms, and you should begin using those new forms immediately. However, if you still have initial forms or still have repeat forms in the existing format, please continue to use those. Now, we undertook two major changes to the new form. The first is related to the structure of the form. We have gone from a current 3-part form to a 5-part form. We've also added color, and I'll discuss those additional parts in a moment. We've also added color. The IEM-1 form, the initial form, now has a green top sheet. The IEM-1A form, or the repeat form, has a goldenrod colored top sheet. In addition, on this top sheet, in the left-hand tab of the form, we have added the form's expiration date. It now says, do not use this form after a certain date. This is in response to feedback we've received from you stating that the current expiration date is difficult to find on the form. And this will hopefully make it easier for all of you in identifying which forms have expired and which forms are current. The final major change is with the demographic fields that we are collecting. We have added fields, we have removed fields, and we've also revised existing fields. And I will cover all of that more in depth during my next few slides. The first of the two new copies is for the parents. This is actually the green form for the initial and the goldenrod form for the repeat. The purpose of the parent copy is to actively involve and educate the parents about the process of newborn screening. This goes hand in hand with the brochure that your hospital should be giving to each new parent entitled, These Tests Could Save Your Baby's Life. The form instructs the parent to take the copy to their pediatrician so that the doctor can obtain a copy of the results. The serial number at the top of the form in red can be used when contacting the laboratory, either directly or via the voice response system, to obtain a copy of the results. Use of this serial number avoids the problems that we often face with misspellings of last names or those babies whose last names change post-discharge. The second of the two new copies is what we're referring to as the submitter copy, or the copy that you should retain as a record of testing prior to submission of the specimen to the laboratory. We would encourage you to use this form to monitor quality assurance and quality control as to how the specimen form was completed within your institution. Like the parent copy, the serial number appears on this form, and you may use this when contacting the laboratory or if you're enrolled in the voice response system to obtain results. Once again, use of the serial number avoids the problem of misspelling or, as I mentioned, those babies whose last names tend to change after discharge. We've also identified two additional uses for this form within your institution. The first is You may want to bundle the submitter copies of each child with respect to the UPS package in which those specimens were loaded. That way, in the event of a lost or delayed UPS package, you can quickly identify the affected children and immediately have them rescreened. The final potential use that we've identified is to ensure that you receive results reports for each child for whom you've submitted a specimen. This closes the loop of newborn screening. That is, it ensures that every baby was screened and that you received a result for every child. You could perhaps attach this form to the results when they return to your hospital. Now I'll cover the major demographic changes to our form. Here is a copy of the initial newborn screening request form, the IEM-1 form. And the four major changes are the addition of the collection of meconium ileus information. That is, if the baby was born with a meconium ileus, you are to check off yes. Otherwise, you may check off no. We have updated the mother's race and Hispanic origin collection information. This is now a simple checkoff box as opposed to the codes currently used on the forms. We have shortened the collection of the mother's Social Security number to simply the last 4 digits of that Social Security number. This is in an effort to protect patient privacy. Once again, we had significant feedback from hospitals that your facilities no longer allow you to use mother's Social Security number or to provide it to an outside entity. And we hope this will alleviate those privacy concerns as well as continue to protect patient privacy. And finally, we've relocated the barcode on the form. The current form actually has the barcode on the tear-off tab on the left side. That's been replaced with the expiration date I mentioned earlier. We've relocated this barcode to this portion of the form for ease of use within the laboratory and request that you be careful not to adulterate this barcode when completing the form, as we need it for our internal procedures. Therefore, please ensure that no labels or pen disrupt this barcode. On the repeat form, the IM1A form, we also have shortened mother's Social Security number to the last 4 digits, and we have the barcode in the same exact position as it is on the initial form. The major change for your facility is that we are no longer collecting current weight information. Now that covers the bulk of the major changes to the form. But I want to take this opportunity to go over each of the fields, relate to you some feedback we've received from you, as well as some common errors we've noted in the completion of these forms while I have you as a captive audience. And I'll remind everybody that the newborn screening regulation in the state of New Jersey states that the specimen collection forms shall be filled in completely, accurately, and legibly. We request that you complete these forms in blue or black ink pen, and as you are now making additional copies, please ensure that you press firmly to ensure legibility. At this point, I want to mention that the parent copy, where you will fill in the baby's last name, is not actually making an additional copy. So what you write on this form will not transfer to the forms below. And so we request, and I boxed in the instructions to submitters that you'll see on the new form, that you enter the newborn's last name in that box on the top, tear off the colored copy, so once again that's green for the initial and goldenrod for the repeat, and give it to the parents along with that brochure. These tests could save your baby's life. Please ensure that you leave the flap covering the filter paper at all times prior to specimen collection to avoid the potential for contamination with finger oils or other contaminants. After tearing off the top sheet and giving it to the parents, you may then complete the remaining demographic portion of the form, which I'll highlight on the next slide. So on the demographic portion of the slide, I'll point out that we still have the existing expiration date as we have on the current form. That is the hourglass with the date of expiration. This is still in addition to now what's on the tear-off tab. This date, and we often get asked, why is there an expiration date for a piece of paper? Well, the filtered paper that's attached to this form is actually an FDA-regulated medical device, similar to any other collection tubes that you use in your daily procedures, whether it's a blood collection tube, a tiger top, a purple top, etc. And therefore, it's required by law to have an expiration date. The expiration date assigned to blood spot filter papers is 3 years post-production. So the date you see here is actually going to be the date that you receive on the forms that we shipped out yesterday, and will continue to ship out until this order is exhausted. So the forms you're getting now will expire in October of 2016. Please pay careful attention to the expiration date prior to specimen collection to ensure that you submit a current form to the laboratory. Now, in the baby's last name section, we request that you simply put baby's last name. We often receive the gender of the baby in this section, but I'd like to point out that we actually have a gender part of the form and request that you mark off whether the baby is in fact a male or female. There is no need to put boy or girl in the last name field. In addition, we often have for multiple births the placement of an A, B, or 1, 2 in the last name field. Like gender, multiple birth has its own place on the form. And if the child is part of a multiple birth, please simply check off yes and indicate the sequence number of the child, whether it's A, B, etc. Please do not circle the example A, B, and C at the bottom of that box, as it is difficult for the data entry staff to see upon entry. Therefore, you do not need to put B in the last name field. For birth date, birth time, date of sample, and date of time, these are essential for our accurate interpretation of the results for congenital adrenal hyperplasia, congenital hypothyroidism, and amino acid disorders. It is imperative that there not be any blanks left in these 4 fields. For type of feeding, as well as antibiotic use, we are referring to the 24-hour period prior to sample collection. That is, what type of feeding has the baby had in the prior 24 hours, as well as have there been any antibiotics administered to the child in the previous 24 hours. If the child has had multiple feeds, that is, breast as well as supplement by bottle formula or even breast formula, you can check off more than one type of feeding. We can enter that into our system. In addition, a simple yes or no checkoff for antibiotics will suffice. As I mentioned, we have the new field meconium ileus, and simply check off yes or no should the child have been born with a meconium ileus. Meconium ileus identification is essential for our cystic fibrosis screening, as it will affect results. For birth weight, we request that you simply put in grams. Do not include pounds, ounces, or kilograms. Birth weight is essential for the program to accurately interpret our results for congenital adrenal hyperplasia. And like birth date, birth time, date of sample, and sample time, it is imperative that this not be left blank. For transfusion information, we are requesting if the child has had any transfusions prior to this sample collection, regardless of date and time. If the answer is yes, that the child received the transfusion prior to sample collection, please check off yes and give the date and time of the most recent transfusion. Transfusions significantly affect hemoglobin results, galactosemia results, and biotinidase results, and accurate information is essential for accurate interpretation of our test results. For gestational age, we ask for whole weeks. We often get decimal points indicating days post in addition to the weeks, but our system cannot input days, so we simply ask that you provide whole weeks in this section. The newborn screening program is in the process of adding severe combined immune deficiency to our panel of 54 disorders to bring us up to 55, and the use of gestational age is important in the accurate interpretation of severe combined immune deficiency results. For baby's medical record number, this number is essential when we're trying to match children, both to abnormal results, but as well as for repeat samples. Mother's contact information. I cannot stress enough how important it is to have accurate information for follow-up. And the follow-up program staff will speak more to this important field coming up after me. But I will stress at this point, we have a section on the form for apartment number floor, and please ensure you include that apartment number or floor if it's included, if the mother actually has one in her address. For mother's age and telephone number, please provide that in the space indicated. And as I mentioned earlier, the updated mother's race and Hispanic origin, as well as Social Security number, would go in the area I've highlighted now. On the current form, as well as going forward, we've provided a space for the collector's initials and date. This is added to the form after feedback from the hospitals who are looking to improve their unsatisfactory specimen submission rate. Therefore, you could use this for internal quality assurance purposes. And since you will be retaining your submitter copy, you will have this initials when we call you should you actually submit an unsatisfactory sample to our facility. So I would encourage you to ensure that those individuals collecting the specimens from the newborns initial and date this form so that you can accurately and effectively use this form to your advantage when trying to improve your unsatisfactory statistics. Finally, we need the hospital's name, address, and phone number. It is perfectly okay for you to use a stamp or a label in this section. If you do use a label, I ask that you be careful about the size of the label and ensure that it does not cover mother's address. Because when we end up having to peel these off to see the mom's address, it actually ends up tearing the form. So if you do use a label or do use a stamper, please ensure that it fits in the area provided. Likewise, for the pediatrician or the physician's information, you may use a stamp or a label provided that it is the current and correct doctor's address. If we receive incorrect information in this section, it could delay the receipt of abnormal results for this baby's doctor. At the bottom of the form, we have a check-off box for whether the specimen was submitted by the hospital or the baby's physician. This is important when we're interpreting non-hospital births, such as out of state, out of New Jersey, or adopted children. And finally, I'd like to bring your attention to the remarks section of the form. We've included a remarks section to provide you an opportunity to give us any additional pertinent information you have. Alternatively, you may use this section to clarify other sections which may have an error. That is, it is not suitable to use whiteout anywhere on this form. Therefore, if there's an error, say the birth time for the child was actually 5:15 a.m. as opposed to 4:15 a.m., we ask that you simply cross out the incorrect information with a single line, initial that, and in the remarks section, indicate the correct information. Before I go on to the repeat form, I just want to make a couple additional notes and ask that if you do use tape on these forms, some hospitals actually tape the form to the baby's chart prior to collection, that you be careful where you place this tape so it does not tear the form or prevent separation of the different parts when it gets to the program. Also be careful not to rubber band the forms together, especially over the filter paper section, as compressed filter paper can affect the absorbency of the filter paper and lead to an unsatisfactory sample. Lastly, I want to bring your attention to the area Do Not Write in this area. In addition to the barcode I mentioned earlier, the Do Not Write in this area section is used internally by newborn screening staff for accessioning into our system, so please ensure that you do not write or put stamps in this area. The repeat form is much like the initial form in that we seek most of the same information. The one difference is that we do have a NICU or special care nursery part, and therefore if the child is on prolonged hospitalization and is in the NICU or the special care nursery at the time of collection, please check off yes. If not, you may check off no. In addition, at the bottom of the form, we have the section for whether the specimen was submitted by the hospital or the baby's physician. We have a larger remarks section here, and that's largely because we use this part of the form internally when ordering tests on a repeat sample. Therefore, be careful with putting stickers or other items in writing in the remarks section. So, in summary, the new form provides a colored receipt, again, green or goldenrod, for parents. We've added a submitter copy for you to retain for your internal records as well as for quality assurance purposes. We've added and revised fields for a variety of diagnostic purposes as well as to ensure patient privacy. And I'd like to remind everybody that accurate information provided to the program ensures accurate results provided back on all the newborns in the state.